Colonoscopy is a procedure which performed in colon to identify different diseases, such as polyps or cancer or many other diseases in the large intestine and rectum. A colonoscopy is performed by a doctor who is experienced in the procedure. This procedure takes approximately 30 to 60 minutes. To perform this test, doctor provides a medicine into your vein to make you feel relaxed and sleepy. Then you will be asked to lie on your left side on the table. During a colonoscopy, the doctor uses a colonoscope. Colonoscope, a long, flexible tubular pipe. This pipe consists a camera to show clear view of intestine. A colonoscope is passed through the anus and advanced to the other end of the large intestine. This pipe is flexible so that it able to bending and move in any direction, so it can easily go around the curves of your colon. You may be asked to change position occasionally to help the doctor move the pipe. This pipe also blows air into your colon, which expanded the colon and helps the doctor see more clearly. You may experience mild cramping during the procedure. You can reduce this pain by taking several deep breaths during the procedure. When the procedure finished, the doctor slowly withdraw the pipe. During a colonoscopy, if the doctor sees something that may be abnormal, then the doctor collects a small amount of tissue for analysis. On the other hand, if doctor found a polyps, then doctor suggests to a surgery to remove polyps. God bless you. Stay healthy, stay safe.